Now, a pediatrician in Southern California, which is where that outbreak began, is taking an unusual step.
That pediatrician is refusing to see unvaccinated patients. News 3 reporter Dave Delozier joins us now with the ethical implications of that decision, Dave.
Yeah, Eric and Michelle, you know, the decisions by this pediatrician are drawing both support and really sharp criticism. At the center of the debate is this: is it justified for a doctor to refuse treatment for some patients to protect others?
Vaccination's critical, I feel.
And the parents of one-year-old Garvin agree, which is why he's receiving his measles vaccine.
Some of the diseases that vaccines can prevent are pretty terrible diseases, and I think that sometimes we've lost touch with that.
While the vast majority of children in this country are vaccinated for the measles, a small percentage are not. And with an outbreak of the highly contagious disease rapidly growing, one pediatrician in Southern California has decided to no longer treat patients who are unvaccinated.
All those other kids who could get measles, I need to protect them. And I can't do what's right for the 10 or 20 people and let the other over 2,000 go by the wayside.
A decision that is drawing opinions on both sides.
I can see it. There's a bit of an ethical dilemma, but I can see that point of view.
I think that is terrible and that everyone should have access to the care of the doctors.
What I believe is it's not so much a right or wrong issue, it's more of an issue of intake.
Mark Lausch is the Dean of the School of Health Education at Madison College. He agrees doctors need to curb the spread of the disease, but not at the expense of an unvaccinated child.
You can see the argument, but there's also a lot of people relying on him for that kind of immediate care. So if somebody does have a child that they suspect has measles, they want to bring him in or her in right away and have the doctor treat him. So I think it's more of a matter of just finding a way to better isolate that patient before they come in and after they leave the office than it is excluding people who are potential patients.
Now, one question this issue raises is that of, does this violate the Hippocratic Oath? And whether it does or whether it doesn't, the Hippocratic Oath is not legally binding, and therefore there is no direct punishment. But Eric and Michelle, one thing that should not be lost in all of this is that the measles is very preventable, and that the that the vaccine is very safe. And it does a great job of preventing the disease.
Certainly a very hot topic right now, and everyone has an opinion for sure. All right, thanks, Dave.
Thanks, Dave.